Good morning. Today we have to discuss about the topic prescription. According to our syllabus, we have to study what is prescription, that is definition of prescription and a model prescription, then parts of prescription, then handling of prescription and errors occur in prescription. Now we have to go through the definition of prescription. What is prescription? Prescription is an order which is written by any doctor, that is any physician, dentist or veterinarian or any other medical practitioner, to a pharmacist for compounding or dispensing a specific medicine or surgical appliances or dresses on a specific period of time. This is the description of prescription. Then the term prescription is derived from two Latin words, that is pre and scriptus. Pre means before and scriptus meaning writing. Then prescription is generally written in the English language, and also Latin words and abbreviations are used to save time. This prescription is written on a special form that is called prescription blank. Then next we have to go through the parts of prescription. These 9 are parts of prescription, that is date, prescriber's name and address, details of patient, superscription, inscription, subscription, signature, renewal instruction, prescriber's signature, date and register number. First one is the date. It indicates the day, month and year in which these prescriptions were written, that is in which the medicines were prescribed and treatment was started. Date is very important in case of prescription containing narcotic and habit forming drugs. By writing the date on prescription, we can avoid the misuse and abuse of prescription containing narcotic and habit forming drugs. Then second one is the prescriber's name and address, that is name and address of the doctor. It is very important because if there is any mistake or any doubt or any corrections in the prescription, the pharmacist can refer back to the prescriber according this address. Then next one is the details of patient. All the details of patient such as name, age, sex and address should be legibly and correctly written in the prescription so that the pharmacist can identify the prescription among several others. And then age and sex of the patient helps to check dose and medication. Then by recording the address, the pharmacist can contact the patient for any references at later stages, and also pharmacist can deliver the medicines personally under any certain conditions. Then next one, superscription. Superscription is nothing but it is represented by the symbol RX. It is an abbreviation of a Latin word receipt, which means take though, or you take, or please take. That is, by using the symbol RX, they are saying please take the medication. Okay. Then this symbol is signated from the symbol of god of Jupiter, who is the Greek god of healing. Then next one, inscription or epigraph. This is the main part of prescription which contain name of the medicine along with the strength and quantity of medicines to be dispensed. In ancient times, all the preparations are compounded at the time of dispensing. In such cases, name of each ingredient along with the quantity and type of dosage form to be dispensed should be mentioned in the prescription. Then in complex prescription, API, that is active pharmaceutical ingredient, that is our main active ingredient. Then adjuvant, that is excipients, then vehicles should be written correctly. Then today we are not practicing the compounding. Here nowadays all the medicines are manufactured in industries and marketed in the pharmacy. Okay, now we are not compounding any products in the pharmacy. All the medicines are manufactured from the industries and only marketed in the pharmacy. Okay, then next one, subscription. It is nothing but it is the direction to the pharmacist. It gives direction to pharmacist regarding the dosage form of preparation and quantity of the medicine to be dispensed and manner of dispense, and if there is any instructions related to the preparation should be written in this part. Then next one, signatura. It is nothing but it is a direction to patient. It gives direction to patient regarding amount of drug to be taken, then frequency and time of administration, route of administration, and if there is any special instruction should be written. Then next one, renewal instruction. It gives an idea about renew or refill of the medicine. It gives an instruction to pharmacist regarding how many number of times the medicine should be dispensed. It is mainly given during two cases, that is first one is a treatment of chronic diseases. Chronic diseases means long-term disease, and then next one, prescription containing narcotic and other habit-forming drugs. Okay. Then last one is the prescriber's signature, date and register number. It is very important in case of prescription containing narcotic and habit-forming drugs, and it also helps the pharmacist to identify the prescriber and consult him in case of any doubts or mistakes. That's all about the parts of prescription. Then it is a model prescription. Here date is written, then these are the details of patient, name, age, sex and address. Then RX symbol, that is our superscription. Then all the ingredients along with their quantity, that is inscription. This Q.S means up to, that is a Latin term. Then in ancient times the Latin terms are mainly used. So then this fiat mistura, it is also a Latin term, Latin word, which means mix to make a mixture, that is the subscription. Okay, fiat mistura is the subscription, that means mix to make a mixture. Then sic cochlear magnum ter indite post cibos sumenda, it is the signatura. Sic cochlear magnum means take 1 tablespoon ter indite 3 times in a day, post cibos sumenda, after food or meal, that is take 1 tablespoon at 3 times in a day after food or meal. Then this is the about renewal instruction. We want to write about renewal instruction here. Then it is the prescriber's name and register number. It is a model prescription. That's all about this topic. Thank you.